Hey everyone! Today we're diving into the secret life of something we see almost every day, a simple pill. We're going to follow the wild, invisible journey it takes inside our bodies, and trust me, it's way more of an adventure than you think. I mean, it seems pretty straightforward, right? You swallow a pill, your headache goes away. But what's actually happening in between? It's this incredible, high-stakes mission, a full-on obstacle course happening right inside of you. So what is the secret? Here's the game plan. First, we're going to look at the two big rule books that control everything. Then, we'll follow the pill as it navigates that crazy obstacle course in your body. After that, we'll see how it actually gets its job done. And finally, we'll check out the insane origin story that every single drug has to survive just to end up on a pharmacy shelf. Okay, so the first thing you need to get is that this whole thing is a two-way street. It's not just the drug acting on you. It's a constant push and pull between what your body is doing to the drug and what the drug is trying to do to your body. And this whole relationship really boils down to two kind of fancy-sounding concepts. On one hand, you have pharmacokinetics. That's your body calling the shots, setting all the rules for how the drug gets in, where it's allowed to go, and when it has to leave. On the other hand, you have pharmacodynamics. That's the drug's mission, what it actually does to make a change. So just think of it this way. Kinetics is the journey, and dynamics is the destination. So let's start with the journey, the pharmacokinetics. This is the physical path, the grand tour our little pill has to take. And it is intense. It's packed with gatekeepers, secret transformations, and a final escape route.
This whole trip has 4 main stages, and there's a really easy way to remember them, the acronym ADME. It kicks off with A for absorption, which is just about getting into the bloodstream. Then comes D for distribution, traveling all around the body to find its target. Next up is M for metabolism, where the body starts to change the drug. And finally, E for excretion, the great escape. Every single pill runs this exact same gauntlet.
But wait, before our drug can even get properly distributed, it slams into a major checkpoint, the liver. You can think of the liver as this super strict security guard. As the drug gets absorbed from your gut, it has to pass through the liver first, which immediately starts to break down or metabolize a big chunk of it. This is called the first pass, and it means that only a fraction of the dose you actually swallowed makes it into your main bloodstream. It's like a tax the body charges on almost every pill you take.
Now, here's something a lot of people get wrong. We tend to think that metabolism is just about destroying or inactivating a drug. But its main job is actually a lot cleverer than that. The body's real goal here is to make the drug water-soluble. And why does it do that? Well, because our kidneys are amazing at filtering water-soluble stuff out of our blood and getting rid of it. So metabolism isn't just about destruction, it's really about prepping the drug for eviction.
Okay, this is where things can get a little complicated, because other things you consume can mess with this whole process. Some drugs, and even things like cigarette smoke, act as inducers. They basically hit the fast-forward button on your liver's enzymes. This makes your body break down certain medications way faster than it's supposed to, and that means a normal dose of some other drug might suddenly not be strong enough to work at all.
And then you've got the total opposite, inhibitors. These guys slam on the brakes, slowing down those liver enzymes. This is also a really big deal because it can cause other drugs to build up in your system to dangerously high, even toxic levels. And that is why your doctor needs to know every single thing you're taking, from prescriptions to supplements.
All right, so our drug has somehow survived the obstacle course. It got absorbed, it got distributed, and it's dealing with metabolism. What's next? Well, now it's time for the actual mission. This is the pharmacodynamics part, what the drug is actually here to do to the body. The best way to picture this is with the classic lock and key idea. Your body's cells are covered in millions of tiny molecular locks, which we call receptors. Most drugs are designed to be a very specific shape, like a key, that can find and fit perfectly into one of those locks. Once it's in, it can turn it on, block it up, or even turn it backward. And not all keys work the same way. You've got an agonist, which is like the master key. It fits, it turns, and you get a full response. Then there's an antagonist. This is like a key that fits in the lock, but doesn't turn. It just sits there, blocking any other keys from getting in. A partial agonist is kind of like a worn-out key. It works, but only gives you a weak response. And an inverse agonist, that's a really weird one that turns the lock in the opposite direction, causing the reverse effect of what normally happens. Now, when we talk about how good a drug is, there are two words that are absolutely crucial but often get mixed up: potency and efficacy.
Potency is all about the amount of drug you need. A super potent drug works at a really low dose. Efficacy, on the other hand, is about the maximum possible effect a drug can have, no matter how much you take. So a drug can be really potent but not have a very high efficacy, or the other way around. Basically, potency is how much, and efficacy is how well.
So we've seen the journey and we've seen the mission. But how did our pill even get the chance to try? Well, every single approved drug is the hero of its own grueling origin story, a testing process that takes years and costs an absolute fortune.
It's called the clinical trial gauntlet. It starts with phase 1, where the only question is it safe? And it's tested on a small group of healthy people. If it passes, it moves to phase 2. Now we ask for the first time, does it actually work on a few hundred patients? If that looks promising, it's on to the massive phase 3 trials with thousands of people to really confirm everything. Only after clearing all 3 of those hurdles can a drug get approved. And even then, it enters phase 4, where it's monitored for years out in the real world for any rare side effects.
And this gauntlet is unbelievably tough to get through. Get this, over 90% of all drugs that enter clinical trials fail. They're not safe enough, or they just don't work, or they aren't any better than what we already have. So that pill sitting in your medicine cabinet, it's a true survivor. So let's just recap that entire epic life story real quick. First, the drug has to survive the ADME obstacle course, which is its kinetics. Then, it has to complete its mission by acting like a key in a lock. That's its dynamics. And it only gets to do any of that because it survived the brutal origin story of clinical trials. So yeah, from its design at a molecular level to running a marathon through your own body, there's nothing simple about a simple pill. The next time you take one, what are you going to think about? The toll booth at the liver? The specific cellular lock it's trying to pick? Or the fact that more than 9 other drugs failed so that this one could succeed? It's a whole hidden world of science right there in the palm of your hand.